Next slide. Let's talk about witnesses. Witnesses are the core of our work, and you have seen some of them in the video. We recorded 199 witnesses across these 4 locations that we have talked about, but I would like to break it down for you across those locations. In Abuja, we had 38, Damaturu 14, Maiduguri 121, and then in Adamawa State, we had 26. In all, we had 66 military witnesses. We had 23 government officials. We had 34 state medical professionals or personnel who appeared before us. And then we had 76 from non-state actors. In terms of the balance between civilians and military witnesses, you can see it there, 133 to 66. And this is one game that my colleagues played that I really, as an old school, didn't understand. But they were timing the speech, they were timing the testimonies. So we knew those who spoke for the longest, but we're not going to say. But if you look at it, across the 12 weeks, these were the hours of testimonies that we recorded. One of the things we established from the onset is a procedure of transcription. So everybody that said anything before the panel, we have it transcribed and we have it stored in the cloud. In a total of 109 hours, 41 minutes, 44 seconds, the panel took 199 testimonies. Next. One of the major methodology that we adopted from the onset is recognizing that our mandate has a woman face. A woman face not just because it is the subject of abortion, but a woman face because in the Northeast and in any other conflict zone in the world, women and children bear the greatest brunt. So from the onset, the chairman of this panel ensured that we adopted a gender approach to not just our witnesses, but also in terms of protection of witnesses that appeared before us. We adopted a blanket approach to protection of witnesses. And when you see this report, you will understand what I'm saying. So we had 154 males and 45 females. I am sure that we could have had more females if we had more access to victims and if we were operating in an environment that was not as volatile and as where we operated from. And you can see also both the gender distribution across the various cities. You can see in Maiduguri we had 92 males and 29 females, for example. Next. For military witnesses, which I had earlier said were 66, these are the ranks of the military witnesses that appeared before us. 4 military leadership. Military leadership here, we mean the chiefs. So the Chief of Defense Staff and Chief of Army Staff. We had 1 Chief of Army Staff and 1 former Chief of Army Staff. We also had a Chief of Defense Staff and now a former Chief of Defense Staff. Our first witness, 001, happened to be then Major General C.G. Musa, who in the currency of our mandate became the Chief of Defense Staff and is now known as General C.G. Musa. He was our first witness. Next, we were also fortunate that we were able to use the powers of the commission to invite and sometimes summon former theater commanders of the Northeast operations. Of the 12 that were alive at the time of our panel, we were able to bring 10 before us. And you can see their roll call there. All of them appeared before the panel. Please note that the dates you are seeing are the dates of their service as commanders, as theater commanders. As you know, the theater commander is the highest ranking military personnel in the Northeast. And as I have also earlier mentioned, in the currency of our mandate, General Leo Irabor, who you see there on the top, ended his tenure as Chief of Defense Staff. And therein came also General C.G. Musa, who was also a theater commander. He is now the Chief of Defense Staff. We also had Lieutenant General Farouk Yahaya, who appeared before us as Chief of Army Staff, but he was also a former theater commander. Beyond this, we went further to summon and invite commanders of the three major communities that Reuters alleged that the massacre of children took place in. And these were commanders that served in Kukawa, next, commanders that served in New Marte, and commanders that served in Gasarwa. We even went beyond command position to invite some of the operational people who served in those commands. Next, please. Government officials. We had 23 government officials spread across the 3 states. And here we present to you, we had 2 attorneys general who appeared before us, Attorney General of Yobe and Attorney General of Borno State. We also had 2 state commissioners, Commissioners for Health and Commissioner for Women Affairs, 2 permanent secretaries, 2 heads of state emergency management agency, and so on and so forth. And this is their numbers across the states and locations. Next. I will take you to non-state actors. Why did we invite the non-state actors in the first place? The non-state actors were invited because we had whistleblowers who appeared before us. We also had a former chief of army staff who appeared before us and raised allegations to the effect that NGOs in the Northeast were committing abortions. And so we had a detour, and in addition to calling on the military as was our mandate, we now extended our mandate to investigating the work of NGOs in the Northeast. And I am going to speak to that when we come to that. But what you see here is the non-state actors who are traditional rulers, and also we had protected persons, the people that we would never disclose their names. They came from communities. Quite a number of them are victims, some are survivors. We also had before us 3 Boko Haram, ex-Boko Haram commanders, and then we had before us 8 girls who were in forced marriages by Boko Haram. And their testimonies were very chilling. Next. In terms of the traditional and community leaders, the 24 of them that appeared before us, you can see the maps of the different communities that they represented. And we would try to also ensure that we make you understand when the time comes why we had those communities. So we had 5 district heads and 19 village heads, all representing the Marte area of Borno State, the Kukawa area of Borno State, the Guzamala and Gasarwa areas of Borno State. These are very important areas mentioned in the Reuters report, and we brought the traditional rulers from those areas to testify before us. Can we see the NGOs now? So we had 19 testimonies from NGOs, and these 19 testimonies came from 15 NGOs. You can see their logos up there. You can also see their names, and this is for us, our transparency. But we also had NGOs and non-state actors that refused to come, and I will mention them not in any particular order. Of course, my Lord has already spoken about Reuters. Up until when we published this report, we did not receive any cooperation from Reuters. Along the line, as we were investigating, we had whistleblowers that testified that MSF, Médecins Sans Frontières, was involved in a program of abortion. And because we had earlier reached out to MSF to appear before us, and MSF wrote back declining appearance and informing us that they can neither deny or accept what we are telling them about the Reuters report. 2 months after that communication came, we met a whistleblower who testified to the fact that MSF operates clinics and still operates clinics in Borno State where abortions were carried out in specific years that we mentioned in our report. So we reached out to MSF on several occasions, the last even being last week. We have also extended invitation to the International Committee of the Red Cross, and we received a feedback that they were not going to attend the sessions and that they do not operate such health services in Borno State. But as we progressed with our mandate, virtually all the hospitals that appeared before us attested that they have been working with ICRC. In addition, even the military acknowledged that they have been in partnership with ICRC. But the ICRC informed the panel via a letter that they are not going to cooperate with the panel. Next, let's talk about hospital witnesses. We have appearing before us 57 hospital witnesses, including 12 chief medical directors. The chief medical directors are the highest ranking officers in government hospitals. We also had 7 gynecologists because of the context of our investigation. We have.
So it is with the greatest sense of gratitude and responsibility that I formally received the report of the Special Independent Investigative Panel on Human Rights Violations and Counter-Insurgency Operations in the Northeast on behalf of the Governing Council, management and staff of the National Human Rights Commission. This report embodies months of dedicated work in response to allegations of gross violations of human rights against the Nigerian Armed Forces, reported in December 2022 by Reuters. In a 3-part report, Reuters alleged that the Nigerian military conducted illegal and forced termination of 10,000 pregnancies, extrajudicial killings of children, and the violation of the rights of women through targeted attacks during counter-insurgency operations in the Northeast. In response to the grave concerns, the National Human Rights Commission, empowered by Section 5 and 6 of the National Human Rights Commission Act 2010 as amended, which gives it the mandate to receive complaints, investigate human rights violations in Nigeria, and make appropriate determination and compensation to victims of human rights violations, establish this independent panel to conduct a thorough and unbiased investigation. The work of the Special Independent Investigative Panel on Human Rights Violation in Counter-Insurgency Operations in the Northeast reflects a major contribution by the National Human Rights Commission in ongoing efforts to ensure accountability and uphold human rights standards in Nigeria. It is our further commitment to justice, transparency, and accountability to any form of human rights violation associated with conflict and insurgency. Tasked with examining alleged human rights abuses, particularly against women and children, the Commission is pleased that the panel has worked diligently to investigate these monumental allegations and is providing us today with its findings and recommendations that will instigate and inspire multi-stakeholder partnership in our humanitarian response in the Northeast. The panel report, in particular, its findings and recommendations offer both clarity and a call for action. They underscore the complexities and human cost of counterinsurgency operations in the Northeast and provide a blueprint for meaningful reform. They highlight the urgent need for transparency within our security forces and the establishment of mechanisms to protect civilians. As we receive this report today, the National Human Rights Commission is resolute in its commitment to the implementation of this report. In particular, redoubling our collective efforts towards integrating human rights principles into military and counterinsurgency operations across Nigeria. We are even honored to have in attendance today UN agencies and NGOs who have been our long-standing partners in our human rights response to counterinsurgency operations and humanitarian efforts in the Northeast. To the Honorable Justice Aboki and his distinguished panel members, we extend our profound gratitude for your dedication, for your integrity and courage. Your work ensures that the voices of affected individuals are heard and that the pursuit of justice is upheld. We are equally grateful to our General Counsel, the Secretariat team, and our UN partners for their steadfast support. We also acknowledge the cooperation by the Attorney General of the Federation and the Attorneys General of Borno and Yobe states, series of public consultations and conversations on the report. The first of this series will be taking place in Maiduguri next week. We plan to hold similar forums in Damaturu and Yola. In December, the National Human Rights Commission plans to host a civil-military forum where the report and its implementation strategies will be discussed with all stakeholders. Additionally, the National Human Rights Commission will work closely with the military and medical institutions to foster respect for human rights in humanitarian situations. The Nhrc is committed to ensuring that citizens of our Bisari community identified in this report receive compensation and will continue to work with the military and Office of the Attorney General of the Federation and that of Borno State to ensure that justice is served. Never again shall these kind of atrocities go unaddressed. Further, the National Human Rights Commission will liaise with our UN partners to propose human rights-based program focused on the resettlement and reintegration of returnees and vulnerable populations, including children affected by conflict. The findings in this report remind us that the journey towards justice and human dignity is a shared one, demanding collective response and resilience.